Hey everyone, welcome to the second part in my series on why I chose to attend dental school at the University of Iowa College of Dentistry. As with the first video, this was originally filmed about 14 months ago before I even moved to Iowa. Let's see if I was correct in my assessment of how things actually are here at school. You will see some updates throughout where I made a few clarifications. Let's get started.
Hey everybody, happy sunny Friday. I am coming to you live from the Poema Parlor today. This is where my oldest daughter, Jana Doyle, does her incredible bridal hair work. It's amazing. Here's a few pictures of what she does. Unbelievable. On my last episode, I discussed the two not so obvious reasons that I have chosen to attend the University of Iowa College of Dentistry. Those were ethics and integrity. Today, I'm going to talk about some of the very obvious reasons that I've chosen to go to Iowa, even though it's still 855 miles away from where I live, and believe it or not, it is not in Texas. So, what are some of these reasons? Find out on this episode of Dr. Dad the Dentist. Welcome to Dr. Dad the Dentist. I am John Pace, and I will be starting dental school at the age of 50. Thanks for joining me on this crazy dental school journey. So I'm going to share with you 6 obvious reasons why I've chosen Iowa. Why did I pick 6? Everybody does a top 10 list. Why don't you do that? Well, let's be a little bit different. Honestly, I could do 16 reasons why I've chosen to go there, but in the interest of time, I didn't figure anybody would watch a 45-minute video, so I'm just going to do the top 6. And these are not in any particular order. Well, that's not exactly true. Number 1 is number 1 because it's number 1. Let me explain. So what is obvious reason number 1? Well, as weird as it sounds, it actually has nothing to do with dentistry. It is the fact that Iowa has an on-site licensed counselor. Dental school is a very challenging process. If you don't work proactively to keep things in balance, the whole process can go very, very badly. An on-site counselor is unbelievable for helping you keep balanced, for helping you stay focused, for helping you through the process. Mental health issues are a very big soapbox for me. I don't think we have near enough mental health resources in the United States, which is incredibly unfortunate. And the fact that Iowa brings this resource in-house in a full-time staff member who is literally just right down the hall from us, I think that is absolutely next level. That's reason number 1. I haven't seen that at any other school. That is amazing to me.
I was absolutely correct on this point. Our counselor we had most of the year was a man named Jason Wang. I was having some very serious test anxiety struggles and really needed some help. No, I am not ashamed to admit that. We all have things that we need help with. I had a few sessions with Jason and he gave me some pretty amazing test taking and actual relaxation strategies. They were lifesavers. I simply walked into the counseling center, made an appointment, and was able to see Jason. No charge, available for all of us. I can't say enough good things about this.
Okay, so obvious reason number 2, patient. Did you know that the University of Iowa College of Dentistry clinics treat over 170,000 patients every year? It's the largest provider of dental care in the entire state of Iowa. People literally drive for hours to come there to get their treatment. Obvious reason number 3 is that the professors actually practice in the same clinic that the students are learning in. That's right, your professor who's teaching you how to do root canals could be sitting in the chair right next to you treating patients. You get to learn from them in a very intimate way, and you get to observe them and watch them and see exactly how they're doing things and how they are interacting with patients. Here's a very short video from Dean Stanford where he talks a little bit more about this.
You have world-class faculty here. All of them are actually actively seeing patients in the clinics that are right where the dental students are. The students will actually see how the patients are encountered by their faculty because my patients are in the same clinic as the students' clinics are in at least the 3rd year. And so when they see me interacting with my patient in the reception room and how I greet the patient, then they start to see a role model that's right there.
So this is yet another way that you can learn from experts there at the school, not just in the classroom setting, but also in the clinic. So that takes us to obvious reason number 4. This is graduation requirements. In order to graduate from dental school, you have to perform a certain number of different types of procedures. Maybe it's 50 extractions and 5 root canals or whatever. It's kind of surprising to me, though, that this is not standardized across different dental schools. One dental school may have this requirement, one may have another requirement. But where it gets interesting is this. There are many YouTubers that I follow who are either in dental school or have finished dental school, and some of the people that I've talked to personally have also said this same thing. They've said that it's sometimes very difficult to find enough patients who need specific procedures for you to get the minimum requirements to graduate. So they end up having to do things like assisting other students or residents who are performing the procedures that they need and having that count toward the graduation requirements. But one of the great things about Iowa is, as I mentioned just a moment ago, they have over 170,000 patients that come through the clinic every year. What that means is there is no shortage of people who are needing the procedures that you need to hit your minimums in order to graduate. In fact, I was speaking with an oral surgeon and a pediatric dentist at the New Mexico Mission of Mercy just a couple of weeks ago. We were talking about this, and the pediatric dentist said to me, "Don't even worry about the minimum requirements. You are going to do so many more procedures than that that's not even going to be a consideration." He said when he was in school, he wanted to do some extra extractions because he felt like he needed some more practice at it. So the next 3 patients that he had were all extractions. I think one of them was even a full mouth extraction. So if you want to go above and beyond and do some extra treatments on something you're not so comfortable with to learn it better, then all you have to do is ask. Want more extractions? Just ask. Want to do some more root canals? Just ask. The patients are there. That's a very good thing to have that patient pool. So let's move to obvious reason number 5. And this one's going to sound strange, but the reason is teeth. Come on, man. You're going to dental school. Of course, teeth is a thing. You can get that at any dental school, right? Well, not exactly. At almost every school in the US, you have to find the teeth that you're going to work on, that you're going to learn on. So what does that mean? It means you have to ask dentists to save the teeth that they extract and give them to you so that you can learn to do the procedures. Sounds weird, doesn't it? Well, not at Iowa. Because there are so many patients who come through the clinic every year, remember 170,000 of them, they save the teeth that are extracted and they allow us to use those as students. I don't have to go find them. So what does that mean? That means if I need a molar, I just go ask and they give me a molar. That easy.
Okay, I was kind of wrong on this point, but let me explain. No, we don't have to find our own teeth. They are provided for us. But I was wrong on how we get the teeth. They don't actually come from patients in our clinics here at the school. We have a massive network of alumni dentists who send us teeth. We have a team called the Tooth Collector Team, or as my daughters like to call it, the Tooth Fairy Team, and I am fortunate to be on that team. Dentists around the state and really all over the country request bottles from the team. We send them to them, they fill them with extracted teeth and send them back. The Tooth Fairy team then cleans and sorts them, and then when the D2 students need teeth for endodontics, we give them a bag with all the teeth that they'll need for class. It takes probably 40 to 50,000 teeth to get enough usable teeth for all 80 D2 students to have the 12 teeth that they need, but we have them. We literally have 5-gallon buckets full of teeth. Check out this Instagram reel that I posted. This shows some more of the details of how all this works. Dr. Dad, the Tooth Fairy strikes again. Tonight was tooth sorting with Dami, with Big Fun.
Mm-hmm. So now we're just gonna sort through them, right?
Hey, Bob McNeil, can you tell me how in the world this tooth was extracted without being sectioned? This is the craziest looking tooth.
These are some really beautiful teeth I found. I have no idea why they're blue like that. And finally, this is what a 5-gallon bucket full of teeth looks like. And finally, obvious reason number 6 is that we get to do clinical work in our very first year. At most dental schools, you don't start any clinical work on patients who aren't your classmates until your 3rd year. However, at Iowa, you actually get to start your first year. At the end of the first year, you get to do cleanings on people who aren't your classmates. In fact, you get to do it on 2 of them. So my wife will hopefully be my first patient. I don't know if she's super excited about that. Surely she will be, but I'm excited to be able to get to treat her during my very first year.
I actually just saw my first patient 2 weeks ago, and I see my second patient this week. No, it wasn't my wife, but that's okay. My patient ended up being great, and my classmate Gabby was an amazing assistant.
Okay, so let's wrap all of this up.
My why Iowa is that the College of Dentistry here is so student friendly. I will say you never have to sign up for an operatory. We have more operatories than we do providers. You never have to find a patient. We have an abundance of patients and long waiting lists of patients trying to get into our student clinics. We have early entry into the clinic, and the number of procedures that you get to do, but I'm going to say have to do, the number that you have to do is really extraordinary compared to the outcomes from some other schools. You never have to work partnering with another provider. All of the treatment that you're providing alone, and the numbers add up.
In the last episode, I mentioned the two not so obvious reasons, which were ethics and integrity. In this episode, I've mentioned 6 obvious reasons. Those reasons were an on-site licensed counselor, a massive number of patients that are treated at the clinic, professors who practice in the clinic literally right next to you, minimum graduation requirements that are easily exceeded, that you don't have to go find your own teeth, that they're provided for you, and finally, getting to treat patients your very first year. So my plan is to make videos throughout the school year where I talk about each of these reasons why I've chosen Iowa. Are they really like I thought they were going to be? Is everything really working out as I think it would? I think it's going to be very interesting to follow.
Thanks for joining me on this episode of Dr. Dad the Dentist. Follow your dreams, it is not too late. I hope you all enjoyed this look at the 6 obvious reasons why I chose to attend dental school at the University of Iowa College of Dentistry. If you would, please hit the subscribe button below, it really helps. And if you like this video, hit the like button and maybe even leave a comment. That would be fantastic. You can also follow me on Instagram, TikTok, and Facebook. It's at Dr. Dad the Dentist on all of those. See you next time.